Can Renfield Syndrome explain real-life blood drinking? Imagine a person with an intense craving for blood that they can't control. This might sound like something from a horror story, but in real life, there is a condition called Renfield Syndrome, also known as clinical vampirism. It is a very rare psychiatric disorder where individuals feel an obsession or compulsive need to drink blood. This can include their own blood, animal blood, or even human blood in extreme cases. People with this syndrome are not driven by any physical need for blood like a vampire would be. Instead, their behavior is rooted in complex mental health issues. Many of these individuals experience a fascination with blood that can sometimes include a sexual component, where the sight or taste of blood causes feelings of pleasure. But it's important to remember that this is a psychological disorder, not a supernatural phenomenon. Most often, those with Renfield syndrome are males and often have other mental health conditions like schizophrenia, antisocial personality disorder, or post-traumatic stress disorder. They might experience what is called the beast, a hunger for blood that can lead to aggressive or violent actions if they do not satisfy their craving. Some report withdrawal symptoms when they stop drinking blood, such as migraines, irregular heartbeats, or fainting. These symptoms show that the body reacts psychosomatically, not because of a physical dependence. The origins of this syndrome often trace back to childhood trauma or emotional instability. Such early experiences can trigger a fascination with bloodshed and develop into this unusual obsession. In forensic psychiatric cases, some violent crimes have been linked to blood consumption behaviors, which can be a sign of this disorder. Looking at vampire lore and supernatural stories, Renfield syndrome provides a real-world explanation for blood drinking. While it is not caused by any supernatural powers, the behaviors of those affected mirror the myth of vampires, drinking blood and attaching mystical or erotic significance to it. This syndrome can be seen as a psychological echo of vampire legends, where the desire for blood is more about mental health than actual supernatural influence. Understanding Renfield syndrome helps us see that real-life blood drinking is a serious mental health issue, not proof of supernatural abilities. It shows that these behaviors are rooted in psychological disorders that need medical and psychological help. So, while the fascination with blood might seem like something out of a story, in reality, it often points to a complex mental health condition that requires proper treatment.